Today, we're going to talk about case acceptance rate and why it's important to optimize your dental practice and increase revenue. There are so many data points that you can look at as a dental practice owner, and it's hard to hone in on one. And most tools out there throw tons of spreadsheets and dashboards in your face, and it's really hard to understand why that number is important, which is why we built root data so we can get to the root of the data problem so you can grow your revenue and increase profit. So, how I would go about this is really pick one or two data points. Today, we're going to choose case acceptance. And case acceptance for this practice is 32%, which seems kind of low to me. That's this month. So 134 of 413 cases accepted. And let's look at the current month right now. So it's about 36%. So 50 of 136 cases accepted as well. So here's the case acceptance rate. So basically, you're only accepting 1 out of 3 clients walking in the door. And that means 2 are walking away. That's just not a very good number. And you can kind of see over here, we have a little bit more information, and average treatment presented $610. So let's dig in further into case acceptance. So what's our case acceptance this month? So far, we already know that that's below the industry benchmark. 60%, top performing hit 75%. So we basically have to double case acceptance to get to a top performing practice. And we're almost, 2x lower than a good target. So let's see, what are some common levers to boost case acceptance rates? Strengthen case presentation, address financial barriers, make sure the front desk is proactively discussing payment plans and financing options before patients leave, same day scheduling. So let's see how it's trended. So the 6-month trend for case acceptance for Smile Dental, it's gone down. So 40%, and now we're hovering around 36% the last 4 months. So we have a trend here. So something is going on at the practice that we're not addressing, and now we're going backwards. So let's see how much money we're losing. Okay, so tell me how much money I am losing from going from 40% case acceptance to 36%. Let's just ask it a simple math question. Doesn't seem like a big drop now, does it? 4 or 5%, but let's get to the root of the problem and see what's going on here. So average treatment plan was basically $750. Wow. Okay, so the 4-point decline has cost Smile Dental roughly $48,000 in total production in 6 months. That's a lot of money. $8,700 a month that we're leaking and leaving on the table. Annualize a sustained 4-point gap at your current volume would mean roughly $104,000 lost a year. I don't know about you guys, but $104,000 seems like a pretty good amount of money. So we really need to fix that quickly. But before we dig into how to fix it and what to focus on, let's figure out a target to hit. So let's say I get my case acceptance up to, let's just start with 50%. I mean, we should be shooting for 60%, but let's start with 50%. And how would that affect my monthly revenue target. So let's aim a bit lower since we're already struggling and going backwards. And obviously, we want to hit 60%, but we have to be realistic about this 60% number and how long it could take. So, based on monthly production, so that's another 31,400 a month in production. Wow. Without seeing a single new patient. So, you're not trying to get new patients, you're just trying to convert the ones that you have. So that's $376,000 per year that you could be adding to your dental practice revenue. And it's just by getting more patients to say yes. Okay, so this is basically what we need to do: financial presentation. So we don't really need to spend more money on marketing, which is a good thing, right? Because sometimes it's just a marketing problem. You're just not getting enough patients in the door. But in this case, we have all the resources in house. It seems like a little bit of coaching or training. And as a practice owner, maybe getting your hands a little dirty and getting in the trenches a little bit. Urgency framing, same day starts. Is there, before we dig into these, anything, I want to see if there's anything else. So let's just double check. So I guess where we would start to optimize this practice is we'd figure out how we're presenting the financials and if we are generating a sense of urgency. So these are those are the heavy hitters. There's definitely more in the playbook. Treatment coordinator role, verbal skills training, huddle reviews to kind of keep people accountable, visual storytelling. I don't know if you want to go down this rabbit hole yet, follow up systems. So that's an interesting one. Are we following back up with these patients? And what is our follow up procedure? That seems like something that can be solved relatively inexpensively if we have notifications, texts, calls, all that stuff. Online treatment plan delivery, financing options, phase treatment. That's a good one too. People don't like, if you throw 5,000 in front of them, they might be like, "Oh, that's a lot of money." But if you're like, "Hey, it's 5,000 over 6 months," maybe we have something, you know, to get people to commit to. Let's see. Yes, it's asking pull provider level data. Let's figure that out real quick. But I'm going to zero in on these two a little bit more to see what they really mean by that, so we can come up with a plan of action for solving this massive leak in our dental practice, right? So I mean, this is one data point, right? So you could really focus on this for a few months, get it up to 50%. Look how much money that's, fixing for you. And we've got a bunch of data points. You could do it one at a time, but immediately you get clarity in one, where you're leaking revenue and how to fix it. So, all right, it breaks it down by doctor. So, okay, so you can see what Dr. Blake is doing, coach Dr. Carter and Avery. So those seem to be our soft spots. And then kind of figure out what Dr. Flynn is doing. So we have a plan of action now, but one more thing before we call it: explain how to approach these two. What do they mean? So I guess how we're presenting the cost and everything like that. Let's just see what it says. Urgency framing. See, these are like relatively simple fixes, I think, that we could kind of try and address without adding any additional spend to our marketing or anything like that. It's an internal leak, it's a process leak. So, financial presentation, leading with cost confidence, is to normalize cost discussion so they feel like a natural part of care, not a sales pitch. So, you don't really, people get turned off by sales pitches at dentist office. Just so you know, if the doctor recommends any treatment, we'll walk you through all the costs and payments. So before the appointment, digital one pager. We believe everyone deserves great here. The ways we make it affordable. Financing listed. Focus on the why. So this is all pretty sound advice, right? So right now, this is a small cavity we can fix with a filling. If we wait 6 to 12 months, it will likely need a crown closer to 1,200. So I mean, that's reasonable, right? People don't want things to get worse. Root canal. So, yeah, nobody wants a root canal, right? This tooth has a crack that's stable today, but root canal. Okay. So, that's it for today. Thank you so much for watching. But that basically sums up how to zero in on fixing case acceptance.